Hello, DOGTV. Joe Meyers back here with another DOGTV chat and another vet versus vet. We are really excited to talk about this topic today, dog anxiety, what it means, what it doesn't mean, what are some common cures, what's the study of it, and how can you as a pet parent be the best pet parent possible and try to prevent and cure dog anxiety in your little fur family member. So I'm excited to welcome my incredible guest today. But as a quick reminder, on Wednesday, June 17th at 1 p.m. Eastern, we have another Vet versus Vet, Dr. Pohl from the incredible Dr. Pohl and Dr. Henderson from Hanging with the Hendersons, June 17th at 1 o'clock. Check the events page. Make sure you RSVP for that event. But let's get started into pet anxiety. So I'm going to welcome all of my guests, most guests on Vet versus Vet and DOGTV chats so far. Let's talk about dog anxiety and pet anxiety. Let me welcome my first guest. You probably recognize her, Dr. Trina Hazzah. She's an integrative veterinarian oncologist, cannabis educator, and consultant, co-founder, co-president of the Veterinary Cannabis Society. Welcome, Dr. Trina.
Thank you so much for having me again. This is like an honor. It really is. Thank you.
Excellent. Thank you so much for joining us. Our second guest is Dr. Gary Richter. He's the owner and medical director of Holistic Veterinary Care, author of the Ultimate Pet Health Guide, and along with Dr. Hazzah, he's the co-founder and co-president of the Veterinary Cannabis Society. Welcome, Dr. Richter.
Thank you. So great to be here.
Excellent. Thank you so much. And to round out our panel today, we have an influencer, entrepreneur, lifelong pet parent, and founder of Pet Anxiety Awareness Month, Kristen Levine.
Hey, Joe. Great to be here today.
Thank you all for being here. So today we're talking about dog anxiety, pet anxiety. And Kristen, I want to start with you, since you are the founder of the month. Let's start with sort of a brief background on what it means to you, and then we'll talk with the doctors as well.
Sure. No, thank you. So I started Pet Anxiety Awareness Month about 4 years ago because of an experience that I had with what I call my soul dog, Buck. Buck was the dog that I adopted many years ago, and we bonded incredibly. And poor Buck, he suffered from a lot of fear, anxiety, and stress, specifically separation anxiety and noise phobia or noise aversion. And back then, I mean, we're going back like 15 years. And back then, I didn't know much about those conditions. I'd never had a dog that suffered that way. And going through, especially the later years in his life, when his symptoms had really escalated and his destructive behavior escalated, my husband and I felt so helpless. Like it literally altered our lifestyle. We didn't travel for 3 years because we didn't trust we didn't want to leave him with anybody. We were we did some crazy things. That's for another show, how we tried to manage it. And so I learned a lot caring for Buck. And then after Buck passed, I decided that I needed to help other pet parents recognize symptoms of fear, anxiety, and stress at a really early stage when it can be treated or managed or minimized. Unfortunately, by the time we realized what was going on with Buck, he was a pretty accelerated level of those conditions. So it was kind of tough. So anyway, we bring together great veterinarians and brands that are trying to help pet owners. And you can see everything on the website, petanxieityawareness.com. It's just a great resource to help pet parents learn more.
Excellent. Thank you so much, Kristen. Dr. Hazzah, I'd love to give your insight from the medical side as an integrative veterinary oncologist and cannabis educator. What is your insight into dog anxiety and how does it affect patients and individuals and pets yourself?
Yeah, no, it's a great question. I think, unfortunately, cancer in general can be very anxiety producing, right? Not just for the pet, but for the pet parent. And I think we have to keep in mind that the way we respond and what we put out there, our pets actually take in, and a lot of times they mimic, right? And so being able to know, like, hey, listen, if I'm really anxious about this particular thing, I maybe need to not show the pet right? Because a lot of people will come into the clinic to start chemotherapy and they're shaking and their dog is shaking right next to them, right? And so, when we talk about dosing pet with things like cannabis or flower essences or essential oils or whatever it may be for anxiety, consider how you treat yourself as well. As much as you take care of your pet, take care of yourself, because they respond. And for us, what we really want to create in an oncologic setting is, if you're coming in weekly or every other week for chemo, we want to make that experience really good for the patient. And the way to do that is reducing anxiety. We could just say, hey, you're in for chemo and you're out the door, but their experience may not be very good. And that's not fair to them, knowing that they have a limited amount of time, which is very typical for the veterinary cancer patient.
Yep.
And so with that in mind, I think a lot of what I speak on as an integrative oncologist at the at the consult, the initial consult, is how do we reduce anxiety? What are we feeding? What are behavior modifications could you take as a pet parent and for the patient? And then maybe things we may want to add on that may have multi-purpose benefit. So when I talk about things like cannabis and hemp products that are CBD dominant products, these products can be very helpful for multiple levels. One is to help reduce your pet's anxiety when they come in. They may also work. There are preclinical information and some clinical data that supports the use as anti-cancer effect too. So I might be able to get a few different things in reducing inflammation, which can be a starter and a maintainer for cancer, right?
Excellent. We're gonna talk about sort of some cures and treatment, but wanted to get your top line
you
first.
know me, I can't shut me out.
No worries at all. I love hearing from you, Dr. Richter. I'd love to get your, as an owner and a medical director of a holistic veterinary care, on if a dog or a cat walks in and is exhibiting signs of maybe early anxiety, what is where are you starting with that care?
Yeah, it's a really good question, and it's one that we deal with a lot. There's so many potential causes and underlying factors that lead to anxiety. I think one of the really important things to start to really parse out with any individual animal is to try and figure out what's going on with them as an individual. Because there are instances where we may be able to make changes in their lifestyle. We may be able to make other adjustments that can make a huge difference in their underlying level of anxiety. That said, that's clearly not always going to be something that's successful. There are some animals, just like some people, that their anxiety just comes from within, if you will. Some of that's breed specific, some of it not. But, just like there's people that are wound a little too tight, there are animals that follow that same pathway. And as Trina mentioned, they very, very commonly mirror what's going on with their owner. So it's really common to see an owner that's sort of generally uptight, and then their pet kind of is as well. But to answer your question, after we've sort of addressed, the why, the way that I generally approach anxiety in pets to begin with is, almost everything I deal with in my practice starts with nutrition. So much begins with diet, and if these guys are eating the wrong diet, it's not something that you might intuitively think would have an impact on their disposition, but in many cases it really can. So optimizing their diet is often step one. But there's no shortage of natural compounds and natural products out there that have good anti-anxiety effect, that have calming effects. So I do a lot of herbal medicine in my practice, both Chinese and Western herbs. We do a lot of acupuncture. That can be helpful as well. As Trina mentioned, cannabis, whether it's CBD or a more sort of broader preparation of cannabis, can also be very helpful with anxiety. And one of the things that I often make sure to let people know is just like with a person that has an anxiety disorder, number one, it's oftentimes not a quick fix. And number two, oftentimes it's something that you're going to be managing on some level for the long term. I think everybody wants we'll just give him this pill and he'll be fine. You know what? It generally doesn't work that way with anxiety disorders, just as it doesn't in people. And and laying out that expectation early can really help people kind of get in the right frame of mind to manage this.
Excellent. Thank you so much. I think that was a really good point, sort of the magic pill to solve. Kristen, since you experienced this firsthand and use that knowledge and passion to found Pet Anxiety Awareness Month, what is something throughout this process that you've learned about anxiety from, not the veterinarian side, but from the dog mom on the ground side?
Yeah, a couple of things. I mean, I didn't mention this, but I started my career as a PR director for an SPCA, which was here in the Tampa Bay area. And so I know firsthand that the number one reason that pets are surrendered to shelters is for behavior problems. And quite often those behavior problems are a result of an anxiety, an anxious issue that pet has been dealing with, that the pet owner just either doesn't know how to manage or throws their hands up. And like Dr. Richter said, there's really no magic pill. So it's something that, when you adopt a pet, for example, that has an anxiety condition, it's probably something that you will deal with for the life of that pet. So it's extremely prevalent. And I think that as a pet owner and a consumer and not a veterinarian, I know that most pet owners just think about, they're familiar with separation anxiety. They're familiar with, noise phobia, but they're not familiar with all these other triggers, like themselves maybe, or they're not familiar with the fact that one dog can learn from another dog anxiety. So for instance, we just adopted a puppy, and I'm bound and determined that she will not have noise aversion like my 10-year-old dog has. So I think there's so much to learn. And for pet parents, I love that we're having these conversations about natural ways, about diet, about how anxiety plays into treatment for cancer. And it really is woven into the life of your pet, and enough pets experience anxiety to the extent that it affects their quality of life, that we as pet parents really need to learn more about it, and talk to our vets and talk to other pet professionals about it.
Definitely. That's a really good point you brought up there, that there's so many different elements of it. One that's really big and in the media nowadays is separation anxiety. Dr. Trina, what is something, I know you're the oncologist side, that the sort of separation anxiety, what have you sort of seen and noticed in that, and good cures and signs, or maybe signs for recognizing that?
Yeah, I mean, I think so. It's what I think is going to be the hardest is during COVID, right? I mean, our pets are used to having us around all the time now. So how do you, and I'm not a behaviorist, right? But how do you maybe get them more used to you having to go back to work, right? How do you deal with that? And I think that's going to be a really important point. And I think that that's a very good example of what separation anxiety is. And I would probably say start kind of desensitizing them, right? Start going to the store and take a walk around the block. Just don't take a walk and come right back. Starting to get them used to it. If you start and maybe have a camera at your house, you can watch them. One that perhaps you can do talking through, so you can speak to them and say, hey, I'm still here. I'm still talking to you, and really being able to keep that bond going for them. So it's not just you've been with them for 24 hours and now you're gone for 16, because that's going to be really, really hard for them. So I would say utilizing cameras, utilizing, again, the desensitization, getting them used to you leaving. And then lastly, if you find that they're still barking nonstop and it's not working, then finding some remedies for that, like holistic remedies, looking for Western herbs, Eastern herbs, cannabis, of course, as being included with hemp products, right? And really trying to find not one thing will work. Perhaps it's a combination of a few different products, or that thunder shirt that Kristen was talking about, right? You'll find what works best for your pet, and realize some dogs also have PTSD from whatever it may be in their past, right? That plays a big role in being able to realize that every pet is unique, and figuring out what works best for them, and being patient. Start early. Don't just start a few days before you go back to work.
Excellent. Thank you so much. And Dr. Richter, you mentioned briefly about this is not something, a magic pill, and something that you manage. Do you have any advice for maybe a pet parent who's experiencing this for the first time? Maybe their first dog didn't have anxiety, and now this this dog they just adopted from the shelter, which was a wonderful thing, now does. Maybe some tips or tricks on how to manage this for a lifetime.
Sure. Yeah. I mean, and this is a conversation that I have with people quite frequently. And as I said before, I mean, I think one of the first and most important things to do is to lay out expectations. But you know, I mean, I think a valuable metaphor would be to compare your dog that has anxiety, whether it's separation anxiety or what have you, to a person with an anxiety disorder. There is no way that you are going to medicate that anxiety disorder away. Generally speaking, people who have severe anxiety disorders are in therapy. Any medication that they're taking, really the major thing that medication does is it allows that person to be calm enough to where they can listen and reason things out through therapy. And it's a very, very similar thing with dogs. Obviously, we're not doing couch therapy with dogs, but therapy for dogs is training. You know, it's behavioral modification, it's training. So in many cases, when dogs have severe anxiety issues, particularly separation anxiety, I will often refer them to a very good trainer, not necessarily a veterinary behaviorist. A behaviorist is fine for that. It's not always necessary. But some professional that knows how to work with dogs, because there's so many things that we as people do inadvertently that actually feed into and make that behavior worse. Yep. So, you know, the classic example is dog has separation anxiety and the owner comes home and the dog is absolutely just freaking out all over the owner. And if you as the owner, you know, give that dog all the love in the world and tell them what a great dog they are and give them treats, what you're doing is you are rewarding that behavior that you don't want them to do. So most good behaviorists or trainers are going to tell you when you get home in that situation, you should completely ignore your dog until they calm down and they're relaxed, and then go over and tell them they're a good dog and give them love and give them treats. That way you're rewarding them when they're calm. So the point I'm trying to make is that we as people are notoriously bad at making dogs' behavior worse with all the best of intentions. And that's why working with a trainer can be really beneficial, whether it's a trainer alone or a trainer plus supplements, herbs, pharmaceuticals, whatever it may be, having somebody guide you in the path so you know you're doing it right. Because otherwise you may just be reinforcing behaviors and making it worse.
Excellent insight. Kristen, now that you're sort of, your hand is at the pulse of Pet Anxiety Month, what have you seen from the consumer side? You also work in PR and marketing. What have you seen from the consumer side on products and services that have come in to try to help mitigate anxiety?
Yeah, sure. So a couple of things. First of all, there's this whole new category of products available for pet owners called the calming category. And that did not even exist like maybe, I don't know, 10 years ago.
Sure.
And I think besides the medications that are on the market that are, you know, your vet prescribes or, you know, gives your pet, like Thundershirt, I think was like the first natural calming product, or at least from a consumer's perspective, the first calming product. And so the good news is that we have, I don't know, probably thousands, definitely hundreds, but maybe even thousands of natural solutions now to look at. But that makes it kind of confusing, right? So one of the things that I get asked about a lot right now are CBD and hemp products. And so, and if I could, I just want to thank DOGTV, and because you guys are one of our sponsors this year for Pet Anxiety Awareness Month, but also The Anxious Pet, which is a company that makes CBD and hemp products. And I think, actually, if I could toss a question to Dr. Richter, I think the biggest confusion for pet owners is they don't know how to select the right CBD product because there are so many on the market. And so I happen to know this company. I know that they're veterinary formulated, and I know that they're organic and third-party tested. But if, you know, what would you tell a pet owner when they're trying to select a brand of CBD or hemp oil.
Yeah, that is actually one of the reasons that Dr. Hazzah and I founded the Veterinary Cannabis Society, because the landscape out there is so complicated, particularly from a consumer's perspective, and particularly because the person that they really should be asking for that advice is their veterinarian. And in many cases, veterinarians are either not educated enough to have that conversation, or worse yet, they are being forbidden to speak by their state regulations. So that leaves you, the consumer, flying by the seat of your pants. Yeah. So the recommendation I would give for people, and this is not dissimilar from what you just said, but as with anything in life that you're going to, anything of value that you're going to purchase, do your due diligence. So look online, investigate the company. There's a thing called a certificate of analysis when it comes to cannabis products. And the certificate of analysis basically is a chemical analysis, so you know exactly what's in it, what's not in it, by way of like pesticides, fungicides, bacterial contamination, etc. So what you're getting is a safe product. One of the other things I also tell people to do, if they're willing to kind of go one step further, is to actually reach out to the company directly and speak with a human being. My experience with pretty much all supplement companies, but this seems particularly true when it comes to cannabis, is if you pick up the phone and you talk to somebody and they're so excited to talk to you about all of the various things that they do, to make their product safe and effective, if you can't get them off the phone, it's probably a good product. If they're ducking and dodging your questions, there's a reason for that, and that maybe is a product that you should look somewhere else for. But I would also urge people to continue to ask their veterinarian these questions, because the more veterinarians get these questions, the greater the push there is going to be within the profession to make sure that we are better educated. Trina and I are working very hard at doing that. We're putting together continuing education and certification courses for veterinarians so we can get that information out there. But it is slow going.
Yeah.
Excellent question. Thank you, Christian, for that, and thank you, Dr. Richter, for the insight. I'd love for you guys to direct this next answer to somebody who just recently adopted a dog. And Christian, you brought up an excellent point that the number one reason dogs are returned is behavioral issues, potentially caused by anxiety. Dr. Richter, I'll have you go first on sort of your insight or advice to this parent who's just has this dog in their home and is starting to experience some levels of anxiety. They're bringing in a trainer, maybe some motivational speech to them, or something you'd say in their office of like, there's light at the end of the tunnel, or there's a path forward.
Yeah, and there, for the most part, there is light at the end of the tunnel, and I think it's important for people to remember, and I think Trina mentioned earlier that these dogs that come from shelters or come off the street, they have had trauma in their life. And whether you want to call it PTSD or not, they have trauma that they're carrying with them. And some of these dogs, they have been adopted and returned multiple times, oftentimes because of behavioral issues. And clearly that only makes it worse, because now they just have fear of abandonment on top of everything else. Yeah. So I think the advice that I would give to people is try and get out ahead of it as early as you can. Don't wait until it gets worse and the dog has destroyed your couch or something to that effect. As soon as you start to see signs that are a little bit concerning, don't wait. Talk to your veterinarian, talk to a trainer. If it really goes to an extreme sense, talk to a veterinary behaviorist. And as I said before, it's a process. It's an ongoing thing. And the truth of the matter is if this is something that's going on in your life, you have to make a commitment to manage it. There's just no way for me to slice it in any other way, that you just have to make a commitment that you're going to manage it.
Yep. Kristen, same question to you. I know you've experienced it in the past and are trying to walk that line now.
Yeah, I agree. Understand that you're with Dr. Richter, just understanding that you're making a lifelong commitment to this animal, and you may or may not know what their past has been like. I think one of the simplest tips that I've heard and I've even used with my pets is when they're first adopted, establishing a really consistent routine, something where they can expect what time they maybe go in their crate to go to bed. They can expect a consistent time that you get up and let them out, and that's helpful for a lot of reasons, housebreaking and things like that. But pets thrive on routine, and some of the problem with these animals who have been adopted and returned and adopted is there's no routine. They can't predict anything. And so I think if you can establish a really consistent routine, that's going to go a long way to like setting the foundation of helping your animal kind of overcome or manage their anxiety. And I think this is going to be particularly important for people who have adopted pets during the quarantine, like me, have to take my own advice, where this new pet that you have thinks that you're home all the time, and so as Dr. Trina mentioned earlier, start establishing, a new routine, like get up when you're going to get up, when you're going back to work, start feeding them at the time that you normally would feed them when things get back to normal or new normal. But yeah, I think establishing routine is a simple thing that everybody can understand how valuable that would be, and to get your pet started on a good foundation.
Excellent. I love it, guys. Well, thank you both. And Dr. Trina unfortunately had a previously scheduled appointment, so we appreciate her. Check out her, DrTrinaHazzah.com, for all the work she does. If you each want to sort of finish up in maybe some final words of wisdom or sort of insights into where you're at right now, Dr. Richter, I'll have you start, and then Kristen, you'll end with us.
Sure. For anybody out there who has a dog or a cat with anxiety issues, there are things that you can do, and definitely reach out for help, and make sure that you reach out in a sort of a broad enough horizon that you're looking at natural therapies as well as, say, pharmaceutical therapies or training, that sort of thing. Sometimes the natural therapies work better. Sometimes a combination of things, and the quote unquote sort of magic, if you will, for any given individual is going to be different. So I can't tell somebody when they walk in my door, oh, give this combination of things and it's all good. Oftentimes we just have to kind of play with it and figure it out over time. So, stick with it. But at the end of the day, it's so rewarding to know that you've given that pet a stable and loving home.
Excellent. And if people want to learn more about you, maybe pick up your book, where should they go?
They can go either to drgaryrichter.com or my office website, which is holisticvetcare.com. Excellent.
Thank you. And Kristen?
Yes, I would just encourage folks to visit petanxieityawareness.com. Again, I mentioned before that's a website that we've created that just has a variety of resources for pet owners to help them understand the symptoms, some of the solutions. There's interviews with veterinarians. With your permission, Joe, I'd like to share this video on that page as well. And it's just a great place to learn more and actually probably spark some questions for you that you can ask your veterinarian. And there, I think Cheryl on here was asking about separation anxiety. There's a specific interview I did with Dr. Radasta about separation anxiety. So check that out.
Excellent. Well, thank you both. And thank you, Dr. Hazzah, for joining us as well. Dr. Richter, Kristen Levine, thank you guys so much for joining us on Vet versus Vet. Hopefully this was helpful. If you're starting to deal with anxiety, or if you've dealt with it in the past, or you have a new dog who's starting to show signs, hopefully you gain some insight to this. If you're watching at home, please join us back June 17th, 1 p.m., behind the scenes with America's favorite TV vets. So we have veterinarians and naturalists, and now TV vets, Dr. Paul and Dr. Henderson, 1 o'clock Eastern on June 17th. We will see you back here. Thank you all. Have a wonderful day. Bye, everybody.
Thank you.
Bye.
Bye.